Welcome back to Rainier Avenue Radio World. It is me, your host, Tony B. This is our special edition of the impact of the coronavirus on South Seattle and surrounding communities. One of the things that has happened since we started doing these broadcasts, ironically on Friday, March 13th, in the service of our South Seattle communities, is we found that not only did our South Seattle audience begin to tune in heavily, for using us as a resource to find information, but also to share the narrative of what was taking place in their homes and in their communities and their businesses. But we found that the interest grew around the region, the interest grew around the state, the interest grew nationally. I think that has to do with the diversity of our community and even internationally. The listenership picked up exponentially. So we are aware of the fact that even though we hyper-focus on our very diverse community of South Seattle, it's probably because of that diversity that people, again, who want to hear about how this may impact them specifically, tune into Rainier Avenue Radio. Joining me right now is Health Officer and Public Health of Seattle and King County, Mr. Jeffrey Duchin. Mr. Duchin, are you there?
I am, Tony B. Thank you so much for inviting me.
All right. Well, prior to assuming the role of Health Officer for Public Health, Seattle and King County in June of 2015, Jeff served for over 15 years as the Chief of Public Health's Communicable Disease Epidemiology and Immunization section. Jeff trained as a medical epidemiologist in the Centers for Disease Control and Prevention's Epidemic Intelligence Service, after which he completed the CDC's Preventive Medicine Residency Program. That's a mouthful.
Yeah, I'd like to hear that. Nobody else hears.
Mr. Duchin. So let's first kind of just set the table. Tell us your role in simple terms. How are you involved in what's taking place right now in this hot mess called the coronavirus pandemic? What do you do? What is your responsibility?
Yeah, I provide consultation and support to the large team of public health workers who are responding to this unprecedented challenge, both around strategies going forward with respect to identifying the scope and magnitude of the problem, who's infected, and strategies for responding to it. I am a liaison with the Federal Centers for Disease Control, try to help interpret guidance and apply locally, and connect with a lot of our stakeholders in the community, including our healthcare system stakeholders and our frontline healthcare providers and our community members as well.
Okay. When it comes to the health of our communities, right now, at this particular time, from your professional opinion, and again, this may seem like a very simple question, but what does the health of our communities look like right now? And I'm saying that because we're talking about opening, or what they call opening society back up. Folks are wondering when they can get back to work. And Jeff, I'm going to say this. One of the remarks that people make is, we're all in this together, and we're all in the same boat. From my perspective, we're not all in the same boat. We may be in the same flooded, muddy waters, but some folks are in a black boat, some folks are in an Asian boat, some folks are in a disabled boat, some folks are in yachts. Some folks are trying to manage their little dinghies and are taking on water, and they're flooding, and then you have boats that are overturned. So I get the concept when someone says we're all in this together and we're all in the same boat, but the actuality of it is the circumstances that someone was in before this impact how the coronavirus impacts them. So from your perspective, what is the overall health of our communities? And that's probably not going to be one simple answer.
That's exactly right. You summarized it nicely, Tony. When people say we're all in this together, I think what they mean is that this is a global pandemic. Everyone is susceptible, and it's going to affect all of us. It's not affecting all of us equally, just like many conditions don't affect all of us equally. And no one should be surprised that COVID-19 is being disproportionately felt in communities of color. And we just posted today on our website, Public Health Insider, an analysis that looks at the impact, the disparities across our community here in King County that we're seeing. And we know that communities of color have been experiencing disparities across a whole range of adverse health outcomes way too long, not just COVID-19 related. We can look at cardiac disease, respiratory disease, and kidney disease, and asthma, and we know that these are linked to social determinants of health. And so with COVID-19 today, what we showed was that Hispanic and Native Hawaiian Pacific Islanders are experiencing COVID-19 rates at 4 times the rate that white people are. And that for hospitalizations, Native Hawaiian Pacific Islanders and Blacks are being hospitalized at significantly higher rates than whites are. And there's much more information that you can see, but I want to just emphasize that we actually have data that show we're not all in the same boat. And one of the things that we need to do is understand why and what those factors are in these various communities, because we're seeing way too many cases occur. When you ask about the health of the community, this is a serious disease. We are all susceptible, though most of us who get infected will not have a serious illness. Some of us will, and when a disease is very widespread, that some of us adds up to a whole lot of hospitalizations and a whole lot of possible deaths. So what we're needing to do at this point, because everybody is talking about the curve has been flattened and we're talking about possibly going to the next phase, we don't feel like we're ready to do it yet for a number of reasons. There are still too many cases being reported in our community, that those cases are showing health disparities, and we need to find out more about why people in different communities are being affected, what the risk factors are, what's bringing them in contact with the virus, to allow us to further stop the spread before we talk about reopening. That's a long-winded answer, but ask me more if I didn't hit on what you're looking for.
No, and we'll get a little bit into that a little bit more. And again, it's not that I'm pushing back, but I get it when folks say we're all in this together. But if you're an athlete, you were able to get tested. If you were, in different situations, testing was available. Again, maybe the disease affects everybody, but there are just different sets of circumstances for different people in our communities, and I'm going to get back to that. But first, I want to know how the healthcare system in King County and in Washington State has been impacted and affected. We hear about nationally our healthcare workers just being stressed to the point of in some instances crying and having a very difficult time dealing with keeping up with the number of cases. And what shape is our healthcare system in right now, and how has it been affected and impacted by the coronavirus pandemic?
Thanks.
In Washington and King
Excellent
County.
question. So the healthcare system, initially, when we first started seeing these cases accelerating rapidly, early March, took extraordinary measures to decrease the number of people who were coming into the hospital so they could open up beds to care for COVID patients, both on the medical floors, the emergency department, the ICU. They stopped doing large number of surgeries, both to allow more ICU beds to be available and to conserve personal protective equipment. And our community did a very good job of staying home and distancing, and the peak that was feared did not occur. So our healthcare system managed very well using these tactics to make more beds available. Currently, there are still hundreds of good patients in our healthcare system, but there is significant capacity. There is bed availability, and our ICUs are not overloaded. And what my concern is that as we move forward and we start to interact more and more in the community, that we don't get to a point where our health system is going to be overloaded. So we have to manage very carefully going forward, but we're in good shape right now as a community.
All right, then there's going to be a little bit of a statement before this next question. Ultimately, at the end of the question, what I'm going to want to know are what the statistics are that relate to the health disparities and how this impacts our communities of color and poor and marginalized communities. But here in South Seattle, again, we have a very, very diverse community, and we knew right away that this was going to have this was going to be exacerbated in our communities. And when we began broadcasting, I would ask everyone who I could, that whether they were a health specialist or a politician, can you tell us specifically about how this is impacting the communities in South Seattle, where and nobody seemed to have that information. And every other time when you talk about race in South Seattle, people pipe up about this and that and the other, and everything is broken down. Now we're starting to get some information about how this is impacting people of color. Can you kind of take us through this process about why there was a delay? My understanding is that initially there weren't even records being kept on ethnicity and race so just kind of walk us through that process about how we got to where we are now, where it seemed like suddenly there was this interest in how this is impacting people of color, where initially we could not get that information, and then I was told that the information didn't even exist.
Yeah. So, well, there's a couple of questions in there. I'll try and take them one at a time.
Yep.
In Washington State, the healthcare providers are required to report certain conditions to public health, and COVID-19 is a reportable condition. Unfortunately, at this time in Washington State, race and ethnicity is not required. We have requested that from our King County healthcare providers, and get.
Let me stop you. Let me stop you there for a second. I just want to make. Excuse me, Mr. Let me make sure. So, reporting on ethnicity was not required.
In Washington State, that's correct. And I will tell you, though, right now, my understanding is the State Board of Health has decided to make it required. I think it's a good thing. Okay. Not for COVID-19, but for all health conditions. Mm-hmm. Right now, we have pieced together, using data from different sources, the race and ethnicity data on about 70% of our cases. And that's one of the reasons why you're starting to see this information become available, because we have to use multiple data sources to learn about race and ethnicity on the cases that get reported were not included in the case report. So that's one issue. It's just the requirement wasn't there, and incomplete data. Second issue is that we think there's not equal access to testing across the county, so that we don't know for sure that everyone who wants a test and who might have symptoms suggestive of COVID are able to get that test from community to community. And we really want to see that testing expand. And we think that that has taken way too long to happen. So I think earlier in the outbreak, in particular, many of our hospital-based systems had testing available, but many of our community-based providers did not. That's a second reason. And then the third reason we're starting to see more information about race and ethnicity become available now is that you probably recall the outbreak initially was recognized in long-term care facilities, skilled nursing facilities, life care in Kirkland. In many of the early cases, and the vast majority of deaths, even up until today, about 2/3, are associated with these long-term care facility residents who are predominantly white. So as the outbreak spread through the community, we began to see more people of color being impacted. And when we have small numbers, it's very hard to do statistical analyses. So right now, for example, I can tell you that, let me give you an example of some of the data that we're seeing disparities. So for cases overall, we've got about 4,000, let's see, the total number. Okay, so 6,280 cases, 441 deaths in King County. That's overall. And if we look among whites, about 2,200 cases. Among Black, 449, Hispanic and Latinx, 1,016, 583 among Asian, 99 among Native Hawaiian Pacific Islanders, and 29 among Asian American and Alaskan Natives. So we have some of these subgroups get pretty small. When we look at deaths, for example, among the 400 some odd deaths, about 300 are in white, only 17 in Black, 34 in Hispanic, Latinx, 50 in Asian, 4 in Native Hawaiian Pacific Islanders. So in order for us to do analyses and show that one group is statistically, mathematically really different than another, we need to have a certain number of cases occurring. So that's the last reason why it took a while, because we had the majority of our cases and deaths were actually in whites, and as we accrued more disease happening in the community, we were able to make some of these analyses that are helping us understand what's happening with certainty.
You're listening to Rainier Avenue Radio .world. It's me, your host, Tony B. This is our special that we do every Friday now from 1 to 3 on the impact of the coronavirus pandemic on South Seattle and surrounding communities. My guest is Health Director for Seattle-King County, Mr. Jeff Duchin, and thank you for coming on and taking the time to share this information with our communities. And with your extensive background, what has been, if you can name one, or it might be impossible to name one, the biggest challenge for you, and I describe this as a hot mess. What has been one of the biggest challenges for you in addressing this health crisis?
Well, I think by far and away the biggest challenges, our only real weapon against this virus right now is distancing, social distancing, and that is a painful cure. It's hard for individuals, it's hard for communities, it's hard for the economy, and it can't be sustained forever. And so the challenge, how do we slowly manage the virus when there's no vaccine, there's no real treatment available? All we have is the ability to stay away from ourselves and limit the ability of this to spread. That is, for me, the hugest challenge, because it's not, we put it back in the box. It's not going to go away. It's going to be out there when we go out there, and yet we still have to, in some way, get on with our lives. So how do we figure out how to do that as safely as possible, understanding that this is in this for the long haul. There's no putting this back in the box, and we need to be able to all realize that people will continue to get sick, people will continue to get hospitalized, and people will continue to die from this virus. But we need to be able to work and still interact to some degree without having more illnesses, hospitalizations, and deaths than we otherwise would have, and that would overwhelm the healthcare system. And that's my biggest fear, is that we get into another situation where people feel like they don't need to worry more about distancing. We have a lot going on with people getting together, and the health system becomes overwhelmed. And then if you do get sick, you can't get the care that you need. That is, for me, the biggest nightmare.
All right, and again, on Rainier Avenue Radio .world here, we have open, honest, frank conversation that we share with our communities, and I again appreciate you joining me. And don't mean to put you in a tough position here, but from where you sit, because now there's stay at home, and there may be a minority, but a very vocal minority, and I'm not judging whether who are saying we need to get out and we need to get society started again, and this is an infringement on our freedoms, and businesses are failing that may never come back. So ultimately, Jeff, from your perspective as health director, what are your thoughts regarding stay at home versus opening the economy back up?
Right. Well, as I said, staying apart to the greatest extent possible is really our only defense against this virus. And as we come back together, if we don't do it safely, we will have another outbreak that will be very large and will overwhelm our healthcare system. So understand that we have to do certain things. Some things are essential. We want to do as much as we possibly can to get us back to the lives that we had before COVID. but we're never going to be like we were before COVID. This virus is not going away. It's going to be with us for probably forever. It's going to be most likely circulating every year. And what we need to do is learn how to live with it at this time. It will get easier in the future as more people have been infected. We presume that there will be some degree of immunity. The illness will be less severe. There'll be fewer deaths when the outbreaks occur. At this point, we need to figure out how we get back to a safe level of functioning in the community with our economies, with our businesses, and with our social interactions without getting so many cases that our healthcare system's overwhelmed and people will die who otherwise wouldn't. So I think that we're not ready to get back to business because we're seeing already, 80 cases a day in King County right now. And many of those cases are occurring in communities of color. And a proportion of those cases will need hospitalization and some will die. And we need to really be sure that we are having enough testing throughout the county in every community, make sure we're identifying those people who might be infected, that those folks understand the importance of isolating themselves so they don't spread the infection to others, of informing their close contacts and household members so they stay home for 2 weeks and they don't spread the infection to others, and taking all the steps that we need to take to limit transmission so that we don't have to go into another complete lockdown to preserve our healthcare system.
And I think I heard you say this, and correct me if I'm wrong, and I've certainly heard it again from other sources. But from your perspective, you say you're pretty darn sure that as we head into fall and winter, this thing is going to come back.
It's definitely not going away, and the extent to which it comes back will depend on our behaviors. If we stay hunked down, it probably won't come back and overwhelm us. If we start to loosen up, we start to have more interaction with one another, we'll see more cases. And the extent to which it comes back will depend on how safely we can interact in the community without spreading this virus. If we see too much activity, too much impersonal contact, too much face-to-face contact, too many people not social distancing and physical distancing, we'll see too many cases. And so I worry that we're going to see an overwhelming rebound outbreak in the fall if people feel overconfident and they think that we've got this, and we do too much too fast.
Again, you're listening to Rainier Avenue Radio .world. It's me, Tony B. My guest joining me is Health Director Jeff Duchin. When I harken back to our first shows, the information that we were given on COVID-19 was that it wasn't airborne, and you had to touch a surface, and then as we found out more, this has evolved. Do you have any of the latest or newest information about how this disease spreads that you can share with us? And again, it may not be brand new, and some folks just haven't heard it yet. So if you can just kind of update us to the best of your ability and on what you know, how it spreads, how this virus spreads.
Sure. Yeah, this is one of the other great challenges, is a virus that was never before seen in humans, and we're learning as we go. The virus spreads primarily through droplets when someone speaks, coughs, sneezes, or just breathes on someone else who may be close to them. And that's why we emphasize that 6-foot distance, because it's most effectively transmitted at close range. And that's why most of our secondary cases have been household members and not community contact. Direct contact with little droplets come out of somebody's mouth or nose when they cough, talk, sneeze, or contaminate their hand by coughing or covering their mouth, their hand while they cough, or sneezing into their hand, and then touching object surfaces. It could be doorknobs, tabletops, anything that someone touches. If they've got the infection, theoretically could also become contaminated. So that's why we've been emphasizing the need to try to have good environmental cleaning as much as possible. And there is now increasingly information that shows that people who are not symptomatic, people who might be incubating the infection or have mild infection, not even know, can spread this infection. And it's not likely that they are as high a risk for spreading as those who have symptoms who are probably much higher risk, but it can happen. So this is why we advise people to stay away from one another, even if they're well, because they could be incubating an infection that they don't know and could actually spread it before they even know they're ill. It's another reason why these face coverings, cloth face coverings have been recommended by the Centers for Disease Control and other states. They're recommended to protect the community, that someone who wears a cloth face covering is saying, I know that I may be infected with a virus that can hurt you. I may not be aware of that. And by wearing a cloth face covering, I'm going to take steps to reduce the chance that I'm going to spread my infection to someone else. So really, again, droplet transmission from someone's mouth and nose when cough or speak, and then surface contamination from people who don't wash their hands and touch things. That's why hand washing is so critical, not touching the face, nose, mouth, because that's where the virus gets to the body. And then finally, the possibility of spread from people who don't even know they have symptoms.
Well, we're almost out of time here, and I do thank you for coming by and sharing this information with us, specifically our South Seattle community, and as a byproduct of that, with all of our communities and everyone. Much appreciated. I want to get
Can I just say one last thing before we go?
Yeah, that's just what I was about to do. I was about to give you the opportunity because there's so much more we could have talked about with this, but I want to give you the opportunity for final words here. If there's something else that you just wanted to mention or touch on before we go.
A couple of things. One is I just want to say that I'm extending my personal condolences and sympathy to everyone who's been touched by this virus. This is a really hard thing. Even if you haven't sick and don't have a family member, the distancing is very difficult. But especially to people who've had friends, family members, loved ones impacted, sending sincere condolences and sympathy to you and your loved ones. I also want to learn more about what's happening in your community. I was doing a lot of talking today, but I'd like to do some listening at a point. So maybe we can back and hear more. I would like to know about some of the challenges your community members are experiencing with getting tested, maybe getting healthcare, trouble, maybe getting isolation or being safely isolated when they're ill, or having their close contacts quarantined. Anything that folks think they need to be doing to prevent spread and are having challenge with, we'd be really interested in learning more about to try and help. And we've got a place people can send us information, coronavirus@kingcounty.gov. And if you want to send us some feedback, we'd be really very interested in helping understand more about the challenges that your neighbors are facing and trying to address those challenges, because unless we control this outbreak everywhere, it's not going to be controlled anywhere. And we really want to decrease disparities that we're seeing.
Well, I appreciate that, and we will do that. We definitely keep our pulse on the community here, and it's great to hear you say that. And as I had mentioned before, in asking questions, it was hard to get answers, and I appreciate you stepping up to the plate and answering those questions. A bunch of stuff that we couldn't get to that I would love to share with you, and we'll have to get you back on again. There's just so many things that are, I don't want to say they're exclusive, but they're unique to our communities. Once again, Jeff, thanks for joining us here on Rainier Avenue Radio.
Thank you, and stay well.
All right, you do the same. And then again, Jeff, give a shout out to all of those you and healthcare workers who are out there on the front lines, who are putting themselves in the way of danger and taking care of us. Please let them know that we think that they are heroes, and we appreciate what they're doing. And anybody who doesn't think so, we hope you don't get infected with this thing. But if you do, you will certainly realize how valuable our healthcare workers are. So thank y'all.
Thank you, Tony B. Take care.
Yep. Thank you for joining us for another edition of our coverage of and awareness of and information of and education to all things impacting the coronavirus. Again, what we want to do is just share information with you and try to normalize, without fear, day-to-day living here. That's it. That's all the time that I have. That's going to do it for the kid until we get back next Friday. Remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.